Welcome, ladies and gentlemen, and good morning. I want to welcome you to our lecture today. And today we shall specifically be handling topic 3. If you recall, we skipped topic 1 and we went to topic 2. But I did give you reasons as to why topic 1 had to be skipped. Now, what we shall be doing later on, especially after gauging how we are progressing, we may have to go to topic 1, possibly after topic 4, because that's where it fits best. As you're aware, our first lecture was on Zoom, and we did talk about a number of things, including the introduction of the course and placing the course in the whole curriculum of environmental health and safety. Later on, we did go through issues that relate to occupational safety and health, and specifically looking at how organizations go around it, but more so talking about the nature of work. Today, we want to approach this important topic that we call approaches to managing health, safety, and well-being. Ladies and gentlemen, I want to let you know that a number of approaches have been developed and implemented by various stakeholders at various levels to promote employee health, safety, and well-being. And if you look at literature and more so journal articles and the various books that are available, you will agree with me that this area has been well tackled. Now, these approaches that have been taken up by various stakeholders to try and manage this very important subject of health, safety, and well-being could be classified in terms of two aspects, and these are what I'll call approaches. So these two approaches are what we call regulatory approaches, and these are hard approaches, hard or regulatory approaches. Now, these hard and regulatory approaches include things like laws, regulations. For example, if you look at national regulations that have been put in place by various countries to try and manage occupational health, safety, and well-being, these are national regulations. Others are at a higher level, international level, like the International Labour Organization. And these are called conventions, International Labour Organization conventions. And of course, depending on the region where you are, if you are in Europe, you'll be talking about European Union directives. And if you are in West Africa, you can talk about the ones that have been developed by ECOWAS. And if you come to East Africa, then you can talk about COMESA. Southern Africa, you can talk about SADC. All these regional groupings have also come up with various approaches which are very important for us to manage occupational health, safety, and well-being of employees. Now, the second category is what we call the soft. Remember, the first one is the hard, and this includes regulatory. Now we have the soft, or what we call non-binding voluntary approaches. Now, of course, these are developed by countries, developed by recognized national, regional, or what we call sector-specific and international organizations. And of course, these ones may take the form of what we call specifications, guidance. We may also have what we call social partner agreements and establishment of networks and partnerships. So these are very important. You have the hard approaches and what we call the soft approaches. Now this lecture will present and presents and discusses examples of various approaches currently being used to manage health, safety, and well-being. And those are the various aspects that we are going to look at. So in this case, ladies and gentlemen, let us begin by taking a look at the stakeholders and their stakes. Now, the stakeholders and their stakes are very important because we are looking at approaches to managing health, safety, and well-being, and these approaches have been developed and implemented by the stakeholders. So that's why we look at key stakeholders and what their stakes are. So, stakeholders, ladies and gentlemen, are groups or persons who are directly or indirectly involved or are affected by the activities of the enterprise. So stakeholders are very important, and for some of you who have attended my lectures on stakeholder theory, you understand exactly what Freeman was trying to talk about. So when we talk about stakeholders, we talk about groups, we talk about persons who are directly and indirectly involved or affected by the activities of the organizations. Now, these stakeholders include what we call locally affected communities or individuals, and of course they are formal and informal representatives. They also include national or local government authorities. They include politicians, they include civil society organizations, and they include groups with special interests, the academic community, and probably other businesses too. Now, of course, our classification of stakeholders will depend on your understanding and, of course, your conceptualization, because some people have attempted to classify these stakeholders looking at the internal and probably the external stakeholders. Others use the descriptive and the prescriptive approaches. And of course, others will now come up with various groups or groupings to try and classify the stakeholders. Now, as I have already said, most research in the area of health, safety, and well-being has tended to generally focus on the role of the traditional stakeholders, such as government agencies, trade unions, employer organizations, and to some extent, researchers and the academics. So if you are looking at research and publications in the area of occupational health, safety, and well-being, then those are the kind of stakeholders that you are likely to find. Now, this does not mean that the other stakeholders are invalid or they are useless. No, they are, but it depends on how they impact these organizations in as far as occupational health and safety is concerned. So it is quite important at this level for us to note that health, safety, and well-being concerns are relevant to all individuals who have a stake in the organization. And as a result, a number of new stakeholders are always added on the list and they are examined. So these new stakeholders that are increasingly active in these areas, such as insurers, insurance companies, professional associations, standardization bodies, contractors, suppliers, customers, and community members have also been added on the list, and they are quite important. So just give me a few minutes right now to take you through these stakeholders and what their main stakes are. And that's what I'm going to do. And I will not really spend too much time on them, but just highlight what their stakes are. Initially, we've got employers. Employers are major stakeholders because employees certainly do work for the employers. And the employers have specific interests in these organizations, and they are also affected in a number of ways. Now, what are the stakes of the employers in as far as health, safety, and well-being is concerned? So, for the employer's side, good health, safety, and well-being management is of primary importance to ensure that workers remain healthy and productive employees. So these workers are supposed to remain healthy and they are supposed to remain productive. And that is their concern. If they are not productive, they will not make money. They will not be competitive out there. Employers also have a legal obligation to provide safe and healthy workplaces. So employers are quite important, and those are their stakes. Now, how about the second category of stakeholders? These are now employees. So we can't forget employees. Now, for the employees, their stakes are very simple. If a company comes up with a good health, safety, and well-being management program, then this ensures that the employee's health is promoted. Health and well-being of the employees is promoted, and therefore their interest lies in that area. They are interested in remaining productive at the workplace, staying economically active. They also have legal obligations to cooperate with the employers in establishing a healthy workplace. So a healthy workplace is very important, and if employees do not participate in establishing this healthy workplace, then it's very difficult again to maintain what we call occupational health, safety, and well-being of employees. So we go to the third category of stakeholders, and this is government. Now, government's stake or main stakes is in developing and implementing health, safety, and well-being relevant regulations, and of course monitoring that these things are probably implemented by the various organizations. So monitoring and inspection and ensuring compliance becomes really an important aspect of government. So national regulations must be developed, and standards, and the provision of basic health, safety, and well-being services. And of course, these can be provided in the primary healthcare system that is implemented by various governments. Let's go to another category of stakeholders, and these are researchers and the academics. Now, the researchers and the academics have stakes in as far as developing health, safety, and well-being management tools are concerned. They also have stakes in examining the link between exposure to occupational risks and health, and they share information with the practitioners. So it is the responsibility of researchers and the academics to continue developing a body of knowledge that can be utilized by the policymakers. So researchers and the academics are also important as stakeholders. Now, another category of stakeholders include the health, safety, and well-being services. And of course, these ones come up with initiatives and tools. Unfortunately, in developing countries, you've got very few services in this area, if any, anyway, because we do not seem to value some of these things very important. Although various organizations in Uganda have started employing health, safety, and well-being officers who are supposed to take charge of this responsibility. But anyway, these are officers in the organizations, but you also have service providers outside there. Now, the other stakeholder agencies include social security agencies. Social security is really an important institution in any given economy, and their stakes are very simple. Good health and safety and well-being management may reduce the burden of disease and help to reduce rising costs of healthcare on social security arrangements. So they are actually concerned with the health, they are concerned with the safety of employees so that the cost of healthcare can be reduced. And of course, at the end of the day, societal costs of disabilities can be tremendous. So if they really monitor and ensure that a good job is done, then certainly these will be reduced. Now, who are the other stakeholders? We've got health insurance or insurers. The health insurers also have interest in health, safety, and well-being management because they want to reduce the rise of healthcare costs for treatment of occupational diseases. You know, they do provide healthcare insurance, and if they can participate in reducing costs, that will be very important. And this can be through what we call primary and secondary prevention of ailments. So the other stakeholders include healthcare institutions, and of course, they are interested in the prevalence of occupational health problems as a challenge and a burden to the healthcare system. So they want to ensure that these things are reduced. Now, you also have customers. Unfortunately, in the interest of time, we may not be able to go through every stakeholder. I think let me now just rush to possibly one or two, and the rest you can always find this information in the various journal articles and the textbooks that I've already given you. The shareholders are other stakes or stakeholders. Stakeholders are very important because they have stakes, and they are concerned with occupational ill health, right? Because they know that this can lead to high levels of sickness, absence. If employees become sick, they will not report work. And if they also get to know that their environment or the environment does not promote health, then talent outside will not be attracted to that particular organization because of that particular weakness. So you also have other institutions like NGOs, universities, you've got employment agencies, you've got the human resource department in the organization, and you have actors of the judiciary system. They also have interest, and then you have business consultants as well. So those are some of the stakeholders and their stakeholder interests. And they certainly have stakes in as far as health, safety, and well-being of employees is concerned. Now, I want us to note that the diverse stakes of health, safety, and well-being stakeholders are evident in the types of the health, safety and well-being policy initiatives that have been promoted. If we examine the policy initiatives, then we shall know what their interests are. And these include a range of legislative, and we call these hard, and non-legislative, which we call the soft. So the hard and soft approaches certainly do reflect the range of stakeholders that we have. And of course, we're including a variety of other stakeholders like government, trade associations, and so forth. So these initiatives that the stakeholders have come up with, they range from, for instance, legislation, development of national strategy schemes, the standards and the certification, the guidance, the qualifications, the codes of practice, the stakeholder and collective agreements, social dialogue, awareness, raising campaigns, economic incentives, etc., etc., etc. Now, these initiatives do reflect the kind of stakeholders that we have and their interests in the operations of various organizations or companies. Right, so having talked about the hard and the soft approaches to managing occupational health and safety, allow me to talk about the policy approaches at the macro level and the meso level. So these are health, safety, and well-being management, but are these levels, macro and meso level? So now, policy, because we need to understand the concept of policy before we look at the macro level and the meso level management of policies. Now, policy is simply defined as a course or principle of action adopted or proposed by an organization or individual. Remember, we are talking about principle of action or a course of action that has been proposed and probably adopted by an organization or individual. So if that is our definition, then policies can take a number of courses based on various principles and based on the organization or organizations that propose these policies. So policies can therefore be proposed or adopted at the meso level. They can also be proposed and adopted at the macro level, and also adopted and proposed at the micro level of an organization. Now, macro level, this is now macro. Macro level refers to the international or regional or national level. So macro, that is the spectrum that the macro level takes. Could be international, could be regional, and could be national level. So in our case, if we talk about regional, you'll be talking about, for instance, ECOWAS, COMESA, you'll be talking about SADC, you'll be talking about European Union, etc., etc. Now, the second level is the meso level. Now, this refers to the provincial or sectoral levels. So you can talk about sectors within an economy. But if you also have variations in, for instance, districts, you could have those which are district specific. But of course, since our country is very small, we do not have those variations. But in very huge countries like United States of America, where you have states, you may have those which specifically relate to the operations in a particular state. But of course, at the end of the day, they must draw from the national document, which is the constitution of the country. Lastly, and that's the third, the micro level. It refers to the organization, right? The organization where the employee is employed. So that's what it is. So policies, ladies and gentlemen, are just not contained in laws and regulations alone, but they are contained in various documents, as I have already referred to, as I've already mentioned, right? So that's what it is, and these things are evolving from time to time. You will have policies, and they will be developed to handle certain aspects that come up, depending on whether you are talking about the organization, you are talking about the region, you are talking about the international level, etc. Now, public policy affects a greater variety of people and interests than do private decisions. Therefore, governments or other policy actors are at the center of efforts to make and implement public policy. Various governments have interest in this, and they cannot relax. And in addition to these state actors, non-state actors play an important role in influencing policy decisions, in influencing policy developments through organized or what we call pressure groups. These pressure groups have freedom to organize and lobby government, and they can always influence changes in policies, in laws, in regulations that govern employees at the workplace. So these non-government pressure groups, you already know them because I've been talking about them, like business associations, employer associations, trade unions, the mass media, expert and professional associations, etc., etc. The list is quite long, and we may not be able to go through all these stakeholders. Anyway, these are very important, and we just have to understand what's happening. Now, allow me to summarize at this level, not the entire lecture, but information that seems to exist or emerge from the scholarly literature in as far as classified policy level approaches are concerned. Now, according to literature and from the works of scholars like Leka, Jain, and the others, or et al., in their work published in 2011, they classified 5 policy level approaches. Remember, we talked about the macro level approach, we talked about the micro level, and we talked about the meso level regional. But research by these fellows pointed out policy level approaches which are based on 1, legislation development, 2, standards at national or stakeholder levels, then 3, stakeholder collective agreements, 4, international organizational actions, 5, social dialogue initiatives, 6, national strategy development, and 7, development of guidelines. And it doesn't matter, all these can fit in at the macro level, at the micro, or even at the meso level. Now, of course, the list is not exhaustive, because if you dig through literature, you'll find other ideas that certainly do seem to augment the works of those fellows that I have just talked about. Right, so why don't we then briefly look at regulatory approaches to health, safety, and well-being at work. Remember, we had the hard approaches and we had the soft approaches. Now, under the hard, you've got the regulatory approaches. Now, if we start with regulatory approaches to health, right, we we begin by noting that regulations at international, regional, and national level is certainly seen as a significant driver when it comes to health, safety, and well-being at work. So regulation at that level is a significant driver. Regulations at that level significantly drive health, safety, and well-being at work. Now, a global example of international hard law comes from the International Labour Organization, that is the ILO. Now, it has issued from time to time occupational health and safety-related conventions. And at this time, I want to invite you to go and look for that information because it's available on the internet. Please read and understand the International Labour Organization conventions on occupational health, safety, and well-being. Now, these occupational health and safety-related conventions seek to establish basic standards to ensure workers' health and safety. And that's the primary objective. And if countries ratify these, then conventions come into force 1 year after the date of ratification, and it becomes a legally binding document. So ratifying countries in this case commit to applying the conventions in local legislations and practice, and to regularly report on its application. So that's what is happening. And if you go to International Labour Organization conventions, please make sure that you try to read all those conventions which are mentioned in the document. Now, if we specifically pull out convention number 155 and convention number 161 and convention number 187, we discover that these three are recognized as key occupational safety and health conventions, which are relevant to health, safety, and well-being of employees. Now, let me just possibly point out, list 1, 2, or 3 of these conventions and the number of countries that have probably ratified these conventions. Now, I'll start with the Convention 13, and this was adopted in the year 1921. These were referring to, of course, the nature of convention here is on white lead painting. So the number of countries that ratified were 63. In 1921, again, Convention 14, which is on weekly rest, and this was specifically to the industry, only 120 countries ratified. Then Convention 17 in 1925, which refers to workman's compensation, and that is really accidents at the workplace, only 74 countries ratified. Convention 18, again in 1925, on workman's compensations, on occupational diseases, only 68 countries. Now, that is really too far away, but maybe we can come closer to what is happening. For instance, Convention 100 on equal remuneration passed in 1951, only 173 countries ratified. Now, if we go to Convention 170 on chemicals in the year 1990, only 21 countries. And I think you can see this is really quite funny because only very few countries took up that initiative. But let me bring you to 2001 on Convention 184 on safety and health in agriculture. Only 16 countries ratified. And in Convention 187, again developed and passed in 2006, and this was on promotional framework for occupational safety and health convention. Only 42 countries ratified that convention. So I think you can see that although these are very important areas for occupational health, safety and well-being of employees at the workplace, only very few countries take up the initiative to ratify these things. So it's quite important for us to understand these things and be able to conceptualize, be able to unpack and understand the various approaches that have been taken up by various countries and various organizations to try and promote the occupational health, safety, and well-being of employees. Right. Now, as I move towards ending this lecture, ladies and gentlemen, you will allow me to take you through voluntary approaches to health, safety, and well-being at work. Now, remember we've looked at the hard, and these are regulatory. We've got now the soft, right? The soft law approach, and these are voluntary approaches which have been adopted. So, of course, some of them come from recommendations from international labor organizations, or they come from standards set by international standardization bodies. Right, now recommendations are designed to establish standards through the provision of guidance. And of course, sometimes these, if not all the times, they are related to existing conventions. For example, Recommendation 164 on occupational safety and health, passed in 1981, is directly relevant to the convention of the same title. And therefore, these are voluntary aspects which are very important. So, why don't I then talk about some of these few voluntary approaches which have been implemented, and so that after that we go into the micro aspects of these conventions and how they have been implemented by various organizations. Let me refer you to a survey research that was conducted around 2008. Now, a survey conducted in 2008 by BSI Management Systems within the UK reported the business benefits of a formalized organizational safety and health management system. And they recommended the following. They said that, one, a large and significant improvement in regulatory compliance had been observed, and that was around 52%. They also reported a decrease in the overall cost of accidents, and that was at the level of 32%. They also reported a decrease in insurance premiums up to around 17%, and a decrease of over 10% in insurance premiums, and that's around 4%. And of course, they did report their findings in a publication that you can easily find on the internet. Right. How do we then manage occupational health, safety, and well-being at the micro level, at the organizational level? Organizations themselves develop internal guidelines and standards on the basis of existing legislation and soft law policies and good practice principles. Remember, the International Labour Organization has conventions which it has handed out, and national governments and regional bodies or groupings have also come up with their own. Now, an organization is supposed to comply to all these, and organizations also come up with their own guidelines and standards in order to try and comply. And these organizational specific guidelines may be done through business networks or directly by that specific organization. So they can do it themselves or they can go through a network. For example, policy approaches can be developed and implemented at the inter-organizational level, where civil actors, with or without the involvement of government actors, organize to promote specific areas of interest. So they can develop these things and then use, those specific bodies. Like in the case of Uganda, where you have the Uganda Manufacturers Association, the Uganda Small Scale Industries Association, etc. Well, you can actually try to promote these things through these associations and also make the employees aware of what is available. And of course, this may involve the development of policy networks of governments, of organizations, government bodies, businesses, experts, etc., etc. And all these are very important. Right. So, what next then? We need to come up with an integrated approach. We need to examine the integrated approach that organizations can adopt in managing health, safety, and well-being. Now, recently, approaches and models have been developed. Now, these approaches and models that have been developed aim to integrate the various specialist views on health, safety, and well-being at the workplace. Now, an important reason why this is done is the need to combine the two separated worlds of traditional occupational health and safety and workplace health promotion. So it's very important to integrate these things. Although you can talk about the hard and the soft, but integration of these things becomes very important. So while we can talk about prevention of occupational or work-related injuries and diseases, and of course, we can also talk about reducing public health issues at the workplace. We need to combine, we need to integrate, these approaches, macro, micro, and the meso level. And one such example comes from the World Health Organization. Since 2007, ladies and gentlemen, World Health Organization came up with a system. They came up with documents where they redefined their activities in the area of occupational health into activities for workers' health. And in this, both occupational and public health issues, which are relevant to the workplace, were combined. Now, the World Health Organization report developed a health workplaces model, and this health workers or workplaces model highlighted various things that are supposed to be implemented at the workplace. And these things certainly included exposures, they included activities at the physical work. They brought about the social, psychological issues. They looked at issues at the personal health level. So all these were certainly advanced, and various organizations were certainly told to implement these things. So it's very important for us to recognize these things. So as I conclude, right, allow me to summarize these issues which are relevant to advancing work well-being through the total workplace health. So, and these are same issues that come from the World Health Organization report. So one of them is control of hazards and exposure. So issues like chemicals, physical agents, biological agents are articulated, psychosocial factors, human factors, risk assessment and risk management are part of that. 2, organization of work. Here you have issues of fatigue and stress prevention. Now, fatigue and stress may come in if the organization of work is not well thought about. If it is not well thought through, then you have fatigue and stress. Then you have work intensification issues. Right. But anyway, World Health Organization talks about prevention of work intensification, talks about self-staffing, talks about healthier shifts in work. So scheduling of staff becomes very important, and scheduling of activities, overtime management, reduction of risks from long working hours, etc. And then a built environment supports in terms of health, air quality, access to healthy, affordable food options, safe and clean restroom facilities, safe access to the workplace. You visit some organizations today and you discover that the built environment does not actually support health, safety, and well-being. Right? The quality of the air at the workplace is questionable. Access to health at the workplace is horrible. When it comes to food, many people actually starve at the workplaces. Go to restrooms, oh goodness me, you don't have safe and clean restroom facilities. When you talk about eating facilities, you don't have safe, clean and equipped eating facilities. When you talk about the workplace itself, safe access to the workplace, access becomes an issue here. And of course, the environment is designed to accommodate workplace diversity. So those are the issues. Others, you can certainly go and look up these things, and then at the end of the day, we can have a discussion over these things. So ladies and gentlemen, having gone through that, you will allow me to end my lecture here. I will certainly be waiting for the questions that you may want to ask, maybe in terms of clarification. Some of the issues possibly were not very clear to you, and you may want to know or get more insights and information. I'll be more than happy to give you that information. Again, I must thank James for the good job he's doing to post this information on the e-learning platform, and please follow up these things. Remember, this was our lecture number 5 under the series of our lectures on occupational safety, health, and well-being. Remember, our course is Philosophy and Leadership of Occupational health and safety. So this was the 5th lecture, and I will be taking you to our 6th lecture later on, especially when we decide to delve into the challenges and opportunities in translating knowledge into policy and practice to promote health, safety, and well-being of employees at the workplace. I wish you a nice day. Stay home and stay safe. And of course, with the advent of the coronavirus disease pandemic, we have to adopt a new normal, meaning that things will not be the same anymore. And this also has implications to our course, occupational health, safety, and well-being. Enjoy your day. Bye.